Put pen and book along with you. I will give you the explanation part about pharmacology questions too. Coming on to today's first question. Our first question is, Gepirone belongs to which class of drug? First, Gepirone ante enti? Then mechanism of action ento teliste mere answer pettalagutaru. The answer is azapirones. This Gepirone belongs to the class of azapirone. But coming on to mechanism of action, it shows two kinds of actions. It shows two different kinds of actions at 5-HT1A receptor. 5-HT1A receptor lo two different kinds of actions ni chupistundi. First action is agonistic action. It will show agonistic action in presynaptic place. Then it will show partial agonistic action at postsynaptic neuron of 5-HT1A receptor. 5-HT1A receptor lo two kinds of activities ni chupistundi. Two kinds of different activities. One is agonistic activity and other one is partial agonistic activity. Agonistic activity emo presynaptic region lo chupistundi. Coming on to partial agonistic activity, it is shown in postsynaptic region. Is the first question clear for you all? Then coming on to second question, liniments must not be applied on, we should not apply on broken skin. We should not apply on broken skin. These azapirones will show two different kinds of action. At presynaptic region, it will show agonistic action. And at postsynaptic region, it will show partial agonistic action. At 5-HT1A receptor push. Then coming on to third question, methods of granulation. It is direct question, that is fusion method and wet granulation method. But this fusion method and wet granulation method both are same. These are used for effervescent granules preparation. This fusion method and wet granulation method both are same. Wet granulation method, other name is fusion method. This method is used for preparation of effervescent granules. Then fourth question, solutions are dash dosage form. This is also the direct question, that is monophasic dosage. Then fifth question, bulk powders are. Fifth question, bulk powders are non-protective. Bulk powders are non-protective. Then sixth question, benzodiazepines are used as anticonvulsant drugs because of ఎందుకు యూజ్ చేస్తాం? Because of GABA mimetic action. These benzodiazepines are used as anticonvulsant drugs. Mimetic action ante enti? They'll mainly increase the inhibitory activity of neurotransmitter GABA. Mimetic ante increase cheyadam. So this GABA, whatever the neurotransmitter, inhibitory activity of GABA is increased by the benzodiazepines in our brain. So that if the inhibitory action of GABA increase ayindi ante, there will be decrease in your neuronal excitability. Neuronal excitability decrease ayindi ante seizures kuda stop ayindi. Seventh question, which of the following is a tool used to measure the body temperature? Thermometer. Then eighth question, which of the following is a anti-foaming agent? It is the repeated question. I need the answer from you. It repeated questions. That is simethicone. Along with simethicone, this cytostearyl alcohol and castor oil also acts as an anti-foaming agent. ఈ టూ ఎగ్జాంపుల్స్ కూడా నోట్ చేసుకోండి. సిటోస్టిరైల్ ఆల్కహాల్, castor oil. Then ninth question, indicate the enzyme inhibited by fluoroquinolones. In my PDF, I didn't change the question, but in your Edmingle app, they had changed. That is, it will inhibit topoisomerase 4 and topoisomerase 2 activity. Topoisomerase 2 other name into DNA guys. So all three options are correct. All three options are correct. Then 10th question. Which of the following is not a factor affecting the bioavailability of plant-derived drugs? Even this is also the direct question, that is plant color doesn't play any important role. Then 11th question. Among the following, which is the wrong match? Which is the wrong match ante? First options keldam. Heart failure due to insufficient of blood supply, it is correct match. Angina pectoris ante acute chest pain, it is correct. But cardiac arrest, lumen narrows, it is wrong. It is wrong. Heart attack, okay. Insufficient blood supply to cardiac muscle, all are correct. But cardiac arrest, it is wrong. Option C is here correct. Then coming on to 12th question. The form required for the import of Drug and Cosmetic Act. Form required for import of Drug and Cosmetic Act ante 8. But you note one point. Form number 8 ante you note one point. Form number 8 means application made for an import of drug. Application made for an import of drug. Form number 8 ante application made for an import of drug. But form number 10 ante license granted. License granted for the import of drug. License granted for the import of drug. Note చేసుకున్నారా? Two types of forms are used. For application, we'll be taking form number 8, and for license granting for the import of drug, we'll be taking form number 10. Then 13th question. One of the following drug is used in AIDS. It is direct question, that is azithromycin. Azithromycin. But note one point about each drug. Ciprofloxacin, it is used in urinary tract infections. Ciprofloxacin, urinary tract infections. Tetracyclines, urinary tract infections. Acne, and chlamydia infections. Chlamydia infections ante bacterial infections. Tetracyclines are used to treat UTIs, acne, and chlamydia infections. Then amantadine, it is used to treat Parkinson's disease. It is used to treat Parkinson's disease. Tetracyclines, amantadine mechanism of action చాలా mock exams లో నేను చెప్పాను. థర్టీన్త్ క్వశ్చన్ కి ఎక్స్ప్లెనేషన్ నోట్ చేసుకున్నారా? Then 14th, Steven Johnson syndrome is. Steven Johnson syndrome ఎక్కడ యూస్ చేస్తాం? Both sulfamethoxazole, sulfamethoxyrazine. Option D is correct. Then which of the following is a natural colorant? Which of the following is a natural colorant అంటే carotenoids. Then monoclonal antibodies production requires. Even this is also the direct question, that is mouse splenic lymphocytes కావాలి and myeloma cells కూడా కావాలి and mouse కావాలి. So your answer is both A and B. Then 17th, saccharin is an example of artificial sweetening agent. Then 18th, the syrup is dash in nature. This is direct questioning. That is aqueous in nature. Then 19th, adverse effects of nitroglycerin are. Adverse effects of nitroglycerin ante it is thrombin hitting. Yes, correct. Then 20, select the 4th generation cephalosporin among the following. It is direct question, that is Cefpiro. టెలిగ్రామ్ ఛానల్లో ఈ సెఫ్లోస్పోరిన్స్ కి ఎలా గుర్తుపెట్టుకోవాలి అనేసి ట్రిక్ నేను పోస్ట్ చేశాను. వన్స్ యూ రెఫర్ దట్. ఎందుకంటే ఈ డ్రగ్స్ ఆల్మోస్ట్ సిమిలర్ గా ఉంటాయి, కన్ఫ్యూజన్ గా ఉంటాయి. So already we had posted in Telegram along with the tricks how to remember all 4 generations of cephalosporins. Once you refer that. 21, the throat paints are dash liquid preparations. This is direct question, a repeated question, that is viscous. 21. Which of the following vaccine is killed vaccine? Which of the following vaccine is killed vaccine? That is Salk polio vaccine. Salk polio vaccine. Then 23. Mexiletine belongs to. Mexiletine will belongs to class 1B drug. Class 1B drug. Then 24. An injury sustained by the hypothalamus is most likely to interrupt and uses regulation of body temperature. And 25th. Dash drops are used in otic cavity. Otic cavity anisadigaru. It is ear. Then 26. This part of human brain is also referred as emotional brain. Emotional brain. Idi nenu cheppanu nenu. I need the answer from you. Limbic system. Correct. And in uses anni rainchanu. The repeated question. Then 27. Nasal drop should have pH. Nasal drop should have pH 6 to 7. Then 28. Streptomycin bounds to which type of RNA? It will binds to 30S. It will binds to 30S. Do you know the mechanism of action of streptomycin? No. Do you know the mechanism of action of streptomycin? If you know, you chat, we know. If you don't know, okay. Streptomycin, it will mainly binds to, you note down that, you note down what I am dictating. It will mainly binds to 16S RNA of 16S rRNA. 16S rRNA of 30S ribosome subunit. Of 30S ribosome subunit. Irreversibly. This streptomycin binds to 16S rRNA of 30S ribosomal subunit irreversibly, and interfering, and it will interfere with binding of farmyl methionine tRNA. Farmyl methionine tRNA. Methionine tRNA. Farmyl methionine tRNA to 30S subunit. To 30S subunit. To 30S subunit. Once again, I am repeating. Streptomycin will bind to 16S rRNA of 30S ribosomal subunit irreversibly. Ikkada chudandi, not reversibly, irreversibly, and interferes with binding of farmyl methionine tRNA. Binding of farmyl methionine tRNA to 30S subunit. To 30S subunit. And 29th question. A drug not labeled and prescribed manner should be known as misbranded drug. We'll call that as misbranded drug. Then 30. Paracetamol is used as both antipyretic and anti-analgesic. Then 31. The main objective of Pharmacy Act 1948 is to regulate the pharmacy profession. Then 32. The syrup is a nearly saturated solution of sucrose. Then 33. The reason why SA node is a natural pacemaker. I need the answer from you. Yes, correct. Option D is correct. Then bundle of his is a network of. I need the answer from you. That is Marbu fibers distributed in ventricles. నేను ఆల్రెడీ ఒక మాక్ ఎగ్జామ్ లో బండిల్ ఆఫ్ హీజ్ అంటే ఏంటి, పర్కింజీ ఫైబర్స్ అంటే ఏంటి, ఎస్ఏ నోడ్ అంటే ఏంటి ఆల్రెడీ నోట్స్ రాయించు. Then 35th. What will increase the bulk of the product? Diluent will increase your bulk of the product. Then 36. Which of the following is not a use of herbal medicines? Preserving food is not a use of herbal medicines. Then 37. Powders used for external use are. This is direct question. That are dusting powders. Then 38. The component present in solution in large quantity is called as solvent. Small quantity lo unte solute. Then which of these functions will be affected if the medulla oblongata is damaged? Even this is also a direct question. Response when pricked with needle is called tactile sensation. 3. Then 40. Which of the following antiviral drug is used to treat influenza A? This direct question, that is amantadine. Amantadine. Then 41. This cranial meninges is close proximity of the brain tissue. This is direct question. That is pia mater. Dura matter ante it is tough outermost layer. Pia matter ante it is delicate innermost layer. Pia matter అనేది innermost layer. Dura matter అనేది outermost layer. ఇది tough గా ఉంటుంది. ఇది delicate గా ఉంటుంది. But coming on to arachnoid, it is the middle layer. Middle layer. Then 42. Latin terms infricandus means the following dosage form. Infricandus ante enti? To be rubbed in. To be rubbed in. Then screening test for AIDS ante ELISA. ELISA. Then 44. A suitable dash is added to maintain the powders until the mass become coherent but not too dump. This is direct question. That is granulating agent. Why we are adding? Because to improve the flowability. Flowability improve cheyadaniki manam ఇది యాడ్ చేస్తాం. Then 45. A genetically determined abnormal or unusual response to a drug is. This is direct question. That is idiosyncrasy. Idiosyncrasy. Then 46. Dash accepts hydrogen from malate. Dash accepts hydrogen from malate. NAD will accept hydrogen from malate. Then 47. In which year National Malaria Eradication Program. Eradication Program. National Malaria Eradication Program. It is 1969. It is 1953. 1958. The answer is 1958. Then 48. According to IP 2007, oral powders are. According to IP 2007, oral powders are finely divided. Finely divided. Then 49. Acute tolerance is also known as. It is known as tachyphylaxis. Tachyphylaxis. Then 50. The following statement is true about flu cytosine. Is true about flu cytosine. It is broad spectrum antibiotic. It is wrong. It is a prodrug. It is a prodrug. It is correct. కానీ దేని prodrug? Okay, ఇది prodrug. But how it is converted? ఇది prodrug. మనం వేసుకున్న తర్వాత active constituent laga convert kavali. What is that active constituent? I need the answer from you. Do anyone know what is the active constituent of flu cytosine? If you know, you can tell me no. If you don't know, yes, correct. 5-fluorouracil. Flu cytosine అనేది ఒక prodrug. It is converted to 5-fluorouracil inside your bacterial cells. After converting that into 5-fluorouracil, it will interfere with DNA and RNA synthesis. Well, 51. Skeletal muscle relaxants acts on. It will act on both peripheral system and central system. Then 52. Enemas are also called as. They are called as cystine. There is no there. Then 53. Agglutination reaction is more sensitive than precipitation for the detection of, even this is also direct question, that is antigens. Then 54, aspirin, direct mechanism of action. Ivanni correct. Inhibits prostaglandin synthesis, cyclooxygenase, decrease prostaglandin formation. Answer is all there. You take the screenshot of this 54th question. As it is, memorize this. You take the screenshot of 54th question. Why multi-drug treatment is given to TB patients? Is a direct question. Because to avoid the resistance. To avoid the resistance. Then 56. Vinca alkaloids exert anti-tumor activity by. Is a direct question. That is inhibiting the polymerization of tubulin to form intracellular microtubules. This question ni kuda screenshot cheskondi. 56. Direct mechanism of action icharu. You take the screenshot of 56. తీసుకున్నారా screenshot? Did you take the screenshot of 56th question? Then 57. The diuretic increases the risk of kidney stones. This is direct question. That is triamterene. Triamterene will increase the risk of kidney stones. Then 58. All of the following agents belongs to cardiac glycosides except అనేది ఇచ్చారు. Amrinone is not a cardiac glycoside. It is type 3 pyridine phosphodiesterase inhibitor. Type 3 pyridine phosphodiesterase inhibitor. Then 59. Which powder must be sterilized before their use? Surgical powders ni sterilize cheyali. Surgical powders we have to sterilize before they are used. Then question number 60. An example of benzodiazepine used as anti-anxiety drug is. This is direct question. That is chlordiazepoxide. Chlordiazepoxide. Then 61. Which of the following enzymes catalyze the first step of glycolysis? Rendu, both A and B. In your Edmingle they had changed. By PDF I didn't change. Hexokinase and glucokinase. Both A and C are correct. Both A and C are correct. Then 62. Which committee is appointed by the government of India under the chairmanship of Dr. A. Lakshman Swamy Mudaliar? It is again direct question. That is Health and Survey Planning Committee. Then 63. Which of the following is not a vehicle? Butylated hydroxytoluene is not. It is not a vehicle. It is an antioxidant. Then 64. The reason why tricuspid and bicuspid valves are closed. This is my answer. Explanation to saha meeku raయించాను. Yes. Attempted backflow of blood to atria. Then 65. Elixir contains. Elixir contains 5 to 40% of alcohol. Then 66. Which of the following is not an advantage of herbal medicines over synthetic medicines? Faster action అనేది ఉండదు మనకి. It will show slow activity and is slow. Then 67. Which of the following is not a monophasic liquid dosage form? Suspension or monophasic or biphasic? Then 68. Which of the following is not affecting the quality of herbal drugs? Moon phase effect cheyadu. Then 69. 69. It is the match the following. Influenza ante orthomyxovirus. Then ascariasis ante it is Ascariasis lumbricoides. Typhoid fever, Salmonella typhi. Cholera, Vibrio cholera. The option 3, 4, 1, 2. Option C is correct. Option C is correct. Then 70. Anti-helminthic drug is safer in pregnancy, lactating women. ఏది safer అనేసి అడిగారు. That is pyrazine. Pyrazine. Then 71. Choose the correct drug and its mechanism of action, combinations. ఇది ఒకసారి repeated question. It is liquid paraffin stool softener. Liquid paraffin అనేది stool softener. But note one point. ఈ bisacodyl, it is not osmotic purgative, it is stimulant laxative. It is stimulant laxative. This bisacodyl is a stimulant laxative. Lactulose అంటే osmotic laxative. Two options ఏమి ఉన్నాయి? Lactulose అంటే osmotic laxative. Then 72, the study of fundamental legal principles is known as jurisprudence. Then 73, nasal drops are. This nasal drops are isotonic. And 74, what is the instrument used to listen the sound of heart? That is stethoscope. Then 75, counter immunoelectrophoresis is used for the detection of all the above. Your answer is D. Then 76, dash is not a type of syrup. Mixed syrup another, it is not a type of syrup. Then 77, the base that are water washable, non-greasy, can be diluted with water and non-occlusive. This is a direct question. That is water soluble bases. Then 78, which of the following plant families is not commonly used in herbal medicines? This is a direct question. Solanaceae are not used. No. Poaceae are not used. Solanaceae we can use. Poaceae drugs we can't use. Then 79, what is the instrument used for examining the ear? It is otoscope. Then 80, which of the following is not a method of extracting plant compounds? Not a method of extracting plant compounds అంటే fermentation plant compounds extract చేయాలి, alcohol extract చేస్తుంది. Then 81, following drugs are used in epilepsy to prolong the sodium channel inactivation except 81, ethosuximide కాదు. Ethosuximide ఎట్లా వర్క్ చేస్తుందంటే it will work by blocking the T-type calcium channels, which reduce the occurrence of low threshold calcium spikes in urine. ఇదంతా రాయకపోయినా ethosuximide అంటే it works by blocking the T-type calcium channel blocks. Calcium channels ని బ్లాక్ చేస్తుంది. Then 82, action of digitalis on refractory period is. Action of digitalis on refractory period is prolong చేస్తుంది. Then 83, which one of the following products is formed during glycolysis of glucose? Glycolysis of glucose అంటే pyruvic acid అనేది. Then 84, in artificial syrup, which ingredient is used? In artificial syrup, we will use saccharin. Then 85, which of the following is not a disadvantage of herbal medicines? Higher cost అనేది not a disadvantage. Then 86, dash is a gap or time interval between the entry of causative agent in host and appearance of symptoms and incubation period. Then 87, mechanism of action of laxatives. This is direct question. 87, stimulating the adenylate cyclase in crypt cells. Then 88, what is the general term $87 both A and B are correct. ఇది కూడా కరెక్టే. Inhibits the sodium potassium ATPase in villus cells, impairing the electrolyte and water balance. ఇది కరెక్టే. B కూడా కరెక్టే. Both A and B are correct. 87. You take the screenshot of this 87th question. C wrong. Prostaglandins కి అసలు దీనికి సంబంధమే ఉండదు. Both A and B are correct. You take the screenshot of 87th question. Then 88, what is the general term used for anaerobic degradation of glucose to obtain the energy? Is the direct question? That is fermentation. Fermentation. Then 89, which of the following is excipient? Act as a preservative. This is direct question. That is thiomycin. Thiomycin. Then enemas are administered rectally. 91. Another name for leprosy ante Hansen's disease. Hansen's disease. Then 92. Which instrument is used to measure the oxygen saturation in the blood? Even this is also the direct question, that is pulse oximeter. And 93. 93, who was appointed as a 1 second. In 93, who was appointed as a director of Central Drug Laboratory and Central Drug Research Institute? That is Dr. B. Mukherjee. Then 94, dash is used as a throat pain vehicle 4. Even this is also the direct question. That is A. Glycerin. Then 95, the severe side effect of artemisinin. This is the direct question. The severe side effect of artemisinin is none. AV side effects are. Then 96, which tool is used to assist the visualization of internal organs during surgery and endoscopy? Then 97, the most important vitamin for the growth of bacteria and B complex. B complex vitamin uses. Then elixirs are. This is the direct question. Elixirs are hydroalcoholic liquids. Then 99, the loop diuretics that cause autotoxicity is. The direct question, that is furosemide. And 100, which of the following is not a plant-based dietary supplement? Not a plant-based dietary supplement ante fish oil. Then 101, regulation of normal activities of human heart takes place in. 101 ante intrinsically. But note one point. The regulation of normal activities of human heart. The regulation of normal activities of human heart takes place intrinsically. By cardiac conduction system. But ANS, autonomic nervous system, will modulate the heart rate and strengthen the contraction. The regulation of normal activities of human heart takes place intrinsically by cardiac conduction system. But ANS, autonomic nervous system, ANS, can modulate the heart rate and strengthen the contraction. ANS అనేది heart rate ni contraction ni modulate చేస్తుంది. Regulation is done intrinsically by heart only, but these activities are modulated by ANS. Then 102, insufflations are introduced into the body of which body cavities? Nose. Then 103, buffering agents are also called as pH modifiers. Then 104. Anthromycin is which type of following antibiotic? It is anti-tumor type. It is anti-tumor type. Then which of the 105? Which of the following is an instrument used to measure the blood pressure and sphygmomanometer? Then 106. Which of the following is not a mode of action of plant-derived drugs? Very direct question. That is, producing magnetic field is not the mechanism of action of plant-derived drugs. And 107. Powders are more stable than serum. Then 108. Analgesic effect of aspirin. Analgesic peripheral action, both. Option C is correct. Then 109. The drug used in cytotoxic induced vomiting. That is ondansetron. Ondansetron common first line agent. Post operative purpose lo, pre operative purpose lo, annitలలో use. 110. The risk of digitalis toxicity is significantly reduced by the concomitant administration of. The direct question that is triamterene. Hydrochlorothiazide. Put the side heading hydrochlorothiazide. It increases the risk of digoxin toxicity. It increases the risk by lowering potassium levels. So it is not recommended to be used concomitantly with digitalis. Hydrochlorothiazide will increase the risk of digoxin toxicity by lowering the potassium levels. So it is not recommended to be used concomitantly with digitalis. Then captopril kuda icharu. Captopril, it is ACE inhibitor used to treat high blood pressure and heart failure. But it does not have any effect on digitalis toxicity. Digitalis toxicity lo asal etlanti work cheyaledu captopril. Note చేసుకున్నారా points and did you note what I told? Then 111. The monophasic liquid dosage form is dash type of solutions and true solutions. Then 112. What is an instrument used to measure the respiratory function? Spirometer. And 113. Azoles used in systemic route. Ante ketoconazole. Then examples of protease inhibitor. Ante nelfinamide. Rest all drugs are non-nucleoside reverse transcriptase inhibitors. ఈ మిగతా drugs అన్ని non-nucleoside reverse transcriptase inhibitors. Then 115. Incubation period of filariasis. అంటే 6 to 18 months. Then 116. From the below options, which will be the most widely used form of dosage form? అంటే tablets. Then 117. Who is the pioneer and father of pharmaceutical education in India? That is Professor T.K. Gazar and Professor M.L. Scroff. Both A and B are correct. Na PDF lo నేను చేంజ్ చేయలేదు. Both A and B are correct. So option D is correct. And 118. Which of the following is not a classification of మెడిసినల్ ప్లాంట్స్. ట్రీస్ అనేవి క్లాసిఫికేషన్ కాదు. ట్రీస్ అనేది క్లాసిఫికేషన్ కాదు. But you note the explanation of each and every option. Aromatic plants ante ivi medicinal plants. Aromatic plants are medicinal plants that have strong fragrance. You note the explanation? You note the explanation what I'm telling. Aromatic plants, these are medicine. Used primarily for their aromatic properties. Can you wait one second? One second. Now you can hear my voice. Okay, you can hear my voice now. So, no, first you note the explanation of each and every option. With first option, aromatic plants అనేసి ఇచ్చారు. That have a strong fragrance. Wait. I'll leave the meeting and I'll join once again. Wait, one second. I'll join once again. Wait. I'll leave the meeting and I'll join once. Can you hear my voice now? Okay. Okay. I'll repeat from starting. First, aromatic plants గురించి రాసు. Aromatic plants ante these are medicinal plants. These are medicinal plants that have a strong fragrance. That have a strong fragrance. These are medicinal plants that have a strong fragrance and are used primarily for their aromatic properties. For their aromatic properties. And these are used primarily for their aromatic properties. Examples ante eucalyptus oil. Then second option, poisonous plants. Am I going fast? You are comfortable with this type? Fast గా ఏమైనా వెళ్తున్నాను? Okay. Poisonous plants. Second side heading, poisonous plants అని పెట్టుకోండి. These are the plants that contain toxic substances. These are the plants that contain toxic substances. These are the plants that contain toxic substances and can be harmful if they are ingested or even touched. If they are ingested or even touched. దానికి ఎగ్జాంపుల్ రాసుకోండి. belladonna and foxglove. Belladonna and foxglove. That is belladonna and foxglove. Poisonous plants ante this contains toxic substances and they will be harmful if they are ingested. Examples ante belladonna, foxglove. Even this is also the classification of medicinal plants only. But coming on to trees. Trees ante these are not classified in the medicinal plants. This classification kindiki raadu. This trees doesn't comes under the classification of medicinal plants. Even though if some medicinal plants may grow as trees, but this is not this trees doesn't comes under classification. Ante manaki first introduction, pharmacognosy introduction lo alphabetical, taxonomical order atla classification untundi. Kan trees ana oka classification la teeskuntama manamu తీసుకోలేము. ట్రీ అంటే అది ఏ టైప్ ఆఫ్ ట్రీ? ఒక ట్రీ అని పెట్టాం, తీసుకుంటామా? తీసుకోలేము. ట్రీ అంటే యూ హ్యావ్ టు గివ్ ఆన్సర్ వాట్ కైండ్ ఆఫ్ ట్రీ దట్ ఈస్. సో ఆప్షన్ సి ఇస్ కరెక్ట్. ఆప్షన్ సి ఇస్ కరెక్ట్. సో ఫర్ దట్ పర్పస్ ఓన్లీ ఐ టోల్డ్ యూ టు రైట్ ద ఎక్స్ప్లెనేషన్. ట్రీ అంటే ఓకే, ట్రీస్ అంటే మనం అనొచ్చు, కానీ ఏ టైప్ ఆఫ్ ట్రీ, అది మెడిసినల్, ఆరోమాటిక్ అట్లా మనకు తెలియాలి కదా. So option C is correct. Then coming on to 119. Shrubs ante these are small to medium sized woody plants. Shrubs ante stems kada. Stems manam use chestamu. Aloe vera stem, neem stem. So shrubs, these are classified as medicinal classification కిందకే వస్తుంది. బట్ ట్రీ అంటే ఏ ట్రీ అని మనం చెప్పలేము. స్ట్రబ్స్ అంటే ఇప్పుడు చూడండి, అలోవెరా స్టెమ్ పార్ట్ నుండి తీసుకుంటాం, జిన్సెంగ్ స్టెమ్ పార్ట్ నుండి తీసుకుంటాం, ఆ స్ట్రబ్ కిందకే వస్తుంది కదా. 119. The component present in solution in small quantities called as solute. Then 120, which of the following is a type of instrument used to remove debris or foreign objects from the wounds? Even this is also the direct question. That is 120. Sorry, it is forceps. Then 121, which of the following parts of the plant is not used in herbal medicines? Nuts ni manam use cheyalem. Rest all we can use, but nuts we can't use. 122, any substance which have a harmful effect on body, injuring the health or producing death is called as poison. Then 123, Mandel's paint is also known as compound-eyed throat paint. Then 124, which of the following inhibits the DNA replication? UV rays will inhibit the DNA replication. Then 125, suppository bases. The direct question. Suppository bases ante maintain shape, helps in insertion, everything. So all the above are correct. Then 126, cochineal is a coloring agent. It is a coloring agent. Then 127, BID ante Pfizer. Then 128, one of the following is not a triazolum benzodiazepine derivative. 128, this is direct question. That is midazolam. Then 129, gargles must be dashed before the use. You have to dilute. 130, which of the following drugs is topoisomerase first inhibitor? This is direct question. That is irinotecan. But etoxaxide ఇంకా డాక్సోరోబిసిన్ ఇవి టోపో ఐసోమరేస్ 2 ఇన్హిబిటర్స్. ఇక్కడ మనకి 1 ఇన్హిబిటర్ ఇచ్చారు, బట్ ఇటోక్సైడ్ డాక్సోరోబిసిన్ అనే టోపో ఐసోమరేస్ 2 ఇన్హిబిటర్. విన్క్రిస్టిన్ అనేది అది టోపో ఐసోమరేస్ ఇన్హిబిటర్ కాదు, ఇట్ ఈస్ రిలేటెడ్ టు మైక్రోట్యూబ్యూల్స్. యూనివర్సల్ యాంటీడోట్ అంటే చార్కోల్. Then 132. Which of the following drug is not a non-depolarizing agent? 132 is a direct question. That is diazepam non-depolarizing blocker కాదు, it is a benzodiazepam. In 133, direct inoculation method mixture is incubated for. It is incubated for 14 days. 134. Commercially available ELISA kits are used for the detection of all the. Then VDRL test is an example of slide test. 136. Which of the following is not used in HIV-1 treatment? Not used in HIV-1 treatment ante it is rimantadine. Rimantadine is used in influenza A treatment ki use chestam. Rimantadine అనేది influenza A treatment ki use chestam. Then 137. Which of the following is not a component of pharmacognosy study? Not a component of pharmacognosy study ante synthesis of plant components is not a component of pharmacognosy study. Leprosy bacillus is discovered by Joseph Henson. Then 139. The drug of choice for invasive amoebiasis. The drug of choice for invasive amoebiasis is metronidazole. Diloxamide. First diloxamide గురించి రాసుకోండి. Diloxamide, it is used to treat intestinal amoebicide. Then pentamidine, it is used for treatment of pneumocystis pneumonia and leishmaniasis. Diloxamide, intestinal amoebicide, and pentamidine, pneumocystis pneumonia and leishmaniasis. Then 140. Which of the following belongs to long-acting barbiturates? Phenobarbital is a long-acting. Pentobarbital ante short-acting. Pentobarbital, hexabarbital, both are short-acting. But coming on to thiopental, it is ultra short-acting. Thiopental అనేది ultra short-acting. Then 141. Disodium EDTA is an example of chelating agent. Then flecainide belongs to which class? Flecainide belongs to class 1C drug. Then 143. The drugs used in acute attack of angina. అంటే అన్ని drugs use చేయొచ్చు. Then 144. Which of the intermediate of Krebs cycle is utilized in the formation of amino acid? ఇది direct question. That is alpha ketoglutarate. Which of the following is not a mode of administration for herbal drugs? Intravenous injection laga మనం ఇవ్వలేము. Choose a derivative of plant foxglove. 146. Digoxin. Then suspending agents impart viscosity. Viscosity-ni impart చేస్తుంది. 148. Which of the following is not a plant derivative? Which of the following is not a plant derivative? Penicillin, plant derivative కాదు, fungus roots. Then, this is the outermost, I need the answer from you. This is the outermost cranial appendage. ఇప్పుడే నేను notes రాయించు. I need the answer from you. Yes, dura matter, correct. Then 150, give the example of multicellular organism. That is, fungi is your multicellular organism. So, with this, your paper discussion had completed. If you have any doubts, you can ask now. If you have any doubts, you can ask now. VDRL అంటే Venereal Disease Research Laboratory. Venereal Disease Research Laboratory, 130. Azole with systemic root అంటే ketoconazole. Yes, outermost layer dura matter, 142. 142. Flecainide belongs to class 1C. Class 1C drug. We can use first line drugs, avanni first line drugs. We can use everything. Nitroglycerin use cheyachu, propranolol use cheyachu. Which one you want to scroll? Scroll last, ma'am. Question number petandi, rule number 2. 111. 111. The monophasic liquid dosage form is dash type of solutions and true solutions. Last 5. These are the last 5. And 49. Outermost layer dura matter. Do you have any doubts? If you don't have any doubts, I'll leave the meet. And all the best for your tomorrow's exam.